North West London NHS. So Abbas, who we've just been talking about, is part of the same organisation. I don't work on that piece of work that you're asking about around the hospitals. I'm in a different section. It's part of the same piece of work. The bit of whole systems integrated care I'm most interested in is something called embedding partnerships. And I realise some of these words are not particularly helpful when you first come across them, but they were very carefully chosen by our user group, so they're the ones we're using. I don't think they chose whole systems integrated care, but the embedding partnerships idea is theirs. And embedding partnerships is about engaging users in every stage of what we're trying to do in North West London. And North West London has some influence, but doesn't dictate any of the policies of each of the CCGs. So obviously it's made up of the areas that you'll recognise, and it's on our little diagram in the top corner of the first page, of which Hammersmith and Fulham is one. But the CCGs are running the show. What we're trying to do is help where it makes sense to do things over a slightly larger area than perhaps one single CCG. If anybody has any questions or I'm saying something that doesn't seem to make any sense, just shout up, please, and I'll try my best to answer them. We have one slide here on integrated care. It's the first slide over the page. For some reason, it's slide number 1. The second one we're talking about here. And integrated care is something that I think we all, I guess most people here, I think I can safely say everybody who works in NHS North West London and in the NHS more generally and the wider care system really believe in, because it kind of makes sense. We're all sort of patients. We all have loved ones who are patients, and the idea of it being patient-centred is really what integrated care is about. Of course, you all know it tends to end up being far more technical and complicated than that, because in order to truly integrate, you start to have to involve local authorities, housing is important, all sorts of other elements that that cross traditional boundaries. So we can't just worry about what happens in the NHS. That doesn't make any sense. So it's a big challenge, and the pictures here, they're kind of unfortunate in a way. They're not really illustrating what we want to do, because they're just hospital pictures. You'll be surprised how hard it is in the NHS to get good pictures that actually represent patients being at the centre of their care. So the first two pictures are good examples of doctors doing stuff to patients, which is not really what this is all about. And it encompasses the whole concept of out-of-hospital care where you want to see the care. The professionals working for you as a patient or as a patient's relative or carer, to make you the centre of what they're doing. That's what whole systems integrated care is about. And it's been committed to, you'll see on slide 2, there's a nice little vision, which would be hard to disagree with, I think. It's about quality of care, putting patients in the centre, and empowering people to live full lives in the way they want to, rather than having to be beholden to whatever's convenient for the health service providers and the local authorities and care providers, for that matter. There are 3 principles. You will see, some of these you will know very well, and things that are happening all the time. I notice in the newsletter you talk about the 7-day care for GPs. That's the part of the GPs with the central organising and coordinating care. Most people here, anybody who's been involved in any kind of health episode, will know that GPs often aren't at the centre of the care, and the patient is sometimes left not knowing who's really coordinating your care with questions that can't be answered by anybody. I know that's been my experience, it's been the experience of people around me, which is why I'm fairly confident saying that I think this is a vision that everybody's buying into, because we all are in one way or another patients and relatives of patients. The people empowerment, people who are empowered to direct their care and support and receive the care they need in their homes or local communities, are really kind of nice thing to sign up to in theory, but how you turn it into practice is really quite a challenge. And I think you've probably heard quite a lot about that. So what the bit of whole systems integrated care that I'm interested in, embedding partnerships, is what we're trying to do to try and tackle. How do you actually make those nice sounding words a reality? There are people who are working with us who are users of care from all of the 8 boroughs. We have about 2 from each borough. So I don't know if any of you know John Wilmot, who's a member of this group. She's one of our lay partner advisory group members. We have about 20 of those. and I'll say a bit more about how we're trying to expand that at the moment. And the reason we've started with a fairly small number across quite a large area is what we're trying to do is to get a core of people who become quite skilled in that co-design that we're talking about here, which is, we think, co-design is the answer to how you begin to make services genuinely patient-focused. Because you need to start with the planning, the design, the idea, the concept, and have people involved in all of those sections. It's quite a shift from, I mean, I've worked in the NHS for about 20 years, it's quite a shift from the kinds of things we used to do, which is consultation. And to be frank with you, the things I've been hearing a little bit about in what you're referring to here, Sam, about the changes at Charing Cross and so on, you know, it's different to just sort of saying, this is what we've planned, what do you think? The plan's kind of been made. Now, of course, you can object to it, and you know, the country, the history of the country and hospital closures is full of hospitals that we're going to close that aren't closing now. So people do react. But what we're trying to do is say, well, let's not let it get to that stage. Let's start earlier. Let's get people involved in the whole of the process. So that's what co-production, which is it's a very common buzzword at the moment. But in North West London, we're actually leading co-production in a way that you won't find anywhere else, really. There are other areas in England doing it, but nobody's gone quite as far as us. And some of the team went to present something in a European conference, and we seem to be doing things that people across Europe aren't doing. Everybody knows about the idea, but nobody's taking it quite as seriously as we are in North West London.
Demolishing.
So, there's a little definition on slide number 3 about what co-production is. And I'd just draw attention to the fact that it's supposed to be equal. I can talk quite a lot about how we do the lay partner work. And we have a number of rules, and I haven't written quite so much about that because I thought we were going to talk a little bit more about whole systems integrated care. But we have a series of sort of, we call it Touchstone. It was designed by the users, not by us. But it starts, as all of our meetings now do, with this sort of commitment to everybody having an equal voice. Again, sounds nice, and I think we've probably all heard it many, many times. It's really very hard to get right, but you start by making that effort. And in the meetings that we've been having, we do that. So we can point to all of the work that I'm going to come on to in a second in whole systems integrated care in North West London. And each and every one of those groups has had at least 2 of our lay partners, who are people that the definition of a lay partner for us is somebody who is not a health service professional. They bring all sorts of other skills, but they haven't worked in the health service, so they're not already inside, as it were. That's the definition of a lay partner. But apart from that, everything else is included. So we try to draw people with all sorts of diverse and interesting experience. Now, everything that's happened in the last year since the North West London group started working, every committee, every piece of planning has had 2 lay partners on that committee. Some of them have been chairing the committees, some of them have been members. No committee's taken place without them. Which is remarkable. When you see the little organisation diagram, you can put little marks of where everybody's been. It's really nice to be able to see that they're at all levels, so at the very top, the executive board, all the way through to all of the planning groups. And if we can manage to continue that, I think we're beginning to get somewhere towards proper patient-centred planning, which is very exciting. I mean, it's very hard to sort of get that sense of excitement from just talking about these things. It really is. And if any of you join any of these groups, come to some of these meetings, there's a palpable sense of sort of really making a difference and doing things slightly differently. And as I say, I've been involved with a lot of engagement work over the years, and it does feel to me to be quite different. So we're pretty excited about it and very committed to it too. Slide 4 tells you what we've committed to in North West London. So I'll just go off the slide slightly and say what we're actually doing about engaging our lay partners. And we're using the word lay partners. The lay partners group came up with the word lay partners. It's not lay members. All the CCG have lay members. It's different to that. It's people who are working on strategic issues and reacting to things that are being planned at all stages. It's different to lay members. And that's why we use this phrase lay partners. It's not unique. You'll come across it in other places, but that's what we mean by it. And what we have is an advisory group who's been meeting for 6 months. And that's the group from which we've drawn all the members who've been at every stage of the planning up to now. And this is planning for the whole systems that I'll talk about in a second. We also have established a larger forum of 120 people. So obviously there's some of the people who have been really quite keen and willing to join some of these committees are people who feel quite confident in committee situations. So I think looking across it, we don't have the kind of diversity we would like in that group. So we've come up with a second group, which is wider, it's equal, but doing slightly different things. We've got 120 members from across the 8 boroughs of North West London, and that's called the Lay Partners Board. But essentially they're all lay